Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now. Welcome back to another Prescribed by Dr. Nathan Goodyear podcast. Going to continue the conversation about vitamin C, particularly about IV vitamin C, but I want to focus here on a very interesting topic coming off of the heels of the pandemic of vitamin C and infectious disease. Oh, that's right. I am going to go there. So just hold on just a second. But I want to start first by, kind of setting the table, setting the tone, if you will, of the history of vitamin C as it relates to infectious disease. Because as I mentioned back in the kind of historical context, the introduction to this series, if you will, on vitamin C, not just a one-trick pony, and I encourage you to check out that podcast, I kind of laid that out in a timeline. And I want to continue that again because most people look at vitamin C and they think that this is something that's just the last, 24 years. And it really is not. It goes way, way, way back. And again, the first published study that I could find that's in PubMed on vitamin C is in the inactivation of poliomyelitis in vitro by crystalline vitamin C. That's in 1935. 1935. C.W. Jungeblut. 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 Actually did a Google how to pronounce it, so I hope I got that right. But, so this is going back right at 90 years. Long time looking at this connection between vitamin C and infectious disease. But there's an interesting quote from Frederick Klenner, who is really one of the leader transitions from the mid-20th century to the latter half of the 20th century. And he said, vitamin C should be given to the patient while doctors ponder the diagnosis. So what he's saying there is vitamin C first, then consider the diagnosis. And it shows you from a doctor that had used tons of vitamin C, how important he considered it was in the treatment process, that it preset the diagnosis. A study from 1937, another one from Jungeblut, looking at vitamin C and prophylaxis and experimental poliomyelitis, showing that patients with acute viral infection show a depletion of vitamin C and thus an increase in free radicals and cellular dysfunction. I talked about that as it relates to cancer, but it also applies to infectious disease, where, and you see this in sepsis as well, is that with these highly inflammatory conditions, you get a hypovitaminosis or a low vitamin C. And that in de facto becomes like a metabolic scurvy, not a real scurvy as you would see in the extreme version of the vitamin C, such as what the people would, be at risk for in transversing or transporting by ship over the Atlantic Ocean back in the 18th century. But here it's a metabolic acute scurvy as a result of this inflammatory process. And then another publication by Jungeblut in 1937, he kind of dominated the early years of vitamin C, if you will. And he looked at vitamin C in the experimental poliomyelitis. And then he continued on and followed that up in that same year and just expanding the knowledge related to it. But really interesting, an article published that they looked at hospital-based IV vitamin C for the treatment of coronaviruses and other related infectious illnesses. It's by Andrew Saul and Atusio Yangasawa. And really interesting quote from them. They said, research and experience has shown that the therapeutic goal of reaching a peak plasma of 20 millimolars, that's 350 to 450 milligrams per deciliter, is most efficacious. So they're talking there about the most effective dosing, plasma. Again, not capillary glucose. Mentioned that on the last podcast. But 20 to 40 millimolars, that 3050 to 400 milligrams per deciliter, most efficacious. Here talking about infectious disease, but that also applies to cancer, cytotoxic. But here's an interesting quote. No increased toxicity for IV vitamin plasma vitamin C levels up to 780 milligrams per deciliter. has been observed. Now, for me, the question is, have I ever seen a plasma ascorbic acid level or vitamin C level of 780 milligrams per deciliter? That would be a big negative. No, never seen it. And that's even, giving patients 200 grams of vitamin C. So understand, I've never seen that. So this history of infectious disease goes way, 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 way back. And we have to understand that vitamin C is a therapy. Here we're talking about IV, not oral. It's really targeting the future of cancer care that's present today. It's called precision cancer care, the right treatment for the right patient at the right time. And the underarching theme there in this precision cancer care is what's called multiomics. And if you've heard me talk before, I talk a lot about this: genomics, epigenomics, transcriptomics, proteomics, metabolomics, immunomodulomics, hormonomics, microbiomics, and whatever omics. They even have radiomics. So the point here is that this is very much precision care that we're applying to treatment strategy. And vitamin C here is on the front as well of multiomics. Interesting quote. We conclude that supplementation with high-dose vitamin C appears to be able to both prevent and help treat respiratory and systemic infections. Ascorbate at sufficiently high doses can prevent viral disease and greatly speed recovery from an acute viral infection. Now, they're talking about oral vitamin C there, but that's quite the profound statement. And as we went through the pandemic, vitamin C became very much ostracized, as did so many other things. Ivermectin, hydroxychloroquine, vitamin D. I mean, vitamin D and vitamin C. It's like, come on. These are therapies that have been time proven to support the immune system. And vitamin C is an antiviral, again, 1935. So, how these are so ostracized. I think this is a lot of reason why doctors just took pause, because they were like, what? Vitamin C, vitamin D? And honestly, the first days, the first months of the pandemic, there were a lot of doctors like myself that were just kind of, they were shocked that some of the things that we were hearing, because they were completely counter to what had been the knowledge, the awareness, the publications, but also the practice where we would use repurposed medications. We would use therapies that were right available to us as we work to discover new therapeutics. But these were thrown aside, cast aside, and doctors that tried to even bring them in were absolutely ostracized. But under the concept of multiomics, vitamin C really has impact in multiple areas here. Talk about epigenomics, transcriptomics, metabolomics, immunomodulomics. Even from oral route, you can have it on the microbiomics in the gut. That actually can change epigenetic expression there as well. So let's go through the mechanisms of vitamin C as it relates to infectious disease, particularly here talking about immune system. And primarily, we're talking about viral. Observed decreases of vitamin C in plasma and leukocytes during infective periods suggest that the increased generation of oxidative agents is counteracted by reaction with vitamin C. Again, that hypovitaminosis C. Infection, inflammation, reduced vitamin C. So what we know about vitamin C, and we'll go through the points here, and you'll find this in the show notes, so check that out. And of course, as always, check out the show notes because the references will be supported there. And just an aside, and some of you may laugh, you go, well, why do not doctors talk more about this? One word: trolls. That's right, trolls. I'm not talking about some fantasy character. I'm talking about people that troll, file complaints, that claim things, and they basically just saw a organic post and they just decide to make something up. So watch out for the trolls. But anyways, so vitamin C, it's an antioxidant. It reduces reactive oxygenation production that this acute active burst of an infection really promotes. And this is important in preserving and protecting the recruited and infiltrative immune cells that are part of this inflammation, the acute viral syndrome. Cytotoxicity here, I'm not talking about direct cancer killing effects, but I'm talking about the high doses of vitamin C, which again, only be achievable by IV, that is directly cytotoxic to the virus, say viral cytotoxicity. Viral inactivation. So obviously viruses are replicating. there's a study that showed that inactivation of 4 out of 5 viruses within 24 hours, and it rendered them completely innocuous, completely dysfunctional in 48 hours. Herpes simplex virus, cytomegalovirus, parainfluenza virus. Now, the respiratory syncytial virus, it was not as successful there, but overall there was a reduced infectivity of 66% at 48 hours across 4 out of the 5 viruses from vitamin C. That's amazing. What therapy out there can compete against that? Not really any. It inhibits viral DNA transcription. Okay. Again, DNA into RNA, and then RNA goes into protein. But here it's DNA and RNA. That process is called transcription. So if you're trying to impair a virus's ability to regulate and function, stop its DNA to RNA transcription. You're going to stop its ability to build new components, new aspects to build new cells or viruses. It inhibits viral assembly. Vitamin C inhibits the main viral protease. Get this, for the SARS-CoV-2 viral replication. Decreases viral cell entry. See, viruses have to get inside the cell, and vitamin C impairs the ability of a virus to get inside the cell to infect the cell. And you think about it from a cancer perspective, that actually is good, because a lot of the viral genome will get incorporated into the genome of the cancer cell. It increases, this is the vitamin C, innate adaptive immunity. Vitamin C contributes to immune defense by supporting various cellular functions of both the innate and adaptive immune system. It increases T lymphocyte activation through STAT3 activation. And these are the specific mechanisms. So again, trolls, mechanisms, check out the research, please read it. But anyways, T lymphocytes are some of your main immune cells that are recruited to infectious or even here cancer environments, and these are key in terms of targeting as well as activating the rest of the immune system. And it activates viral RNA activity. Talked about DNA, but here it's DNA transcription. Here it's inactivating viral RNA activity. Quote from this article: ascorbate mediates an anti-HIV effect. You heard me right, HIV, by diminishing viral protein production in infected cells. Interesting. Now, what was SARS-CoV-2? Coronavirus. There are components of HIV to it. It's predated SARS-CoV-2. It inhibits viral replication, interferes with the spread of infection through a reduction in viral replication and viral infectivity. The effect is reversible and requires a continuous presence of the vitamin C. So, thus the continuous need of vitamin C. That's why 1 time a week won't cut it. And when we're dealing with infection, it needs to be multiple times a day, as you would do with an antibiotic with a bacterial infection. So vitamin C is not going to play any different. This concept of what's called pharmacokinetics and pharmacodynamics, as it relates to regular conventional medicine, antibiotics, antivirals, the same concept of pharmacokinetics and pharmacodynamics applies here as well. Linus Pauling kind of alluded to this in a quote where he said, when we think about these pharmacokinetics and pharmacodynamics, when it comes to natural substances like vitamin C, they forget that they apply there too. And they do. Chemotaxis, this is the recruitment of immune signaling to the environment and recruiting cells to the environment. Here it's an infectious environment. And then, of course, antigen presentation, where these macrophages or macrophage-like substances, they engulf these viruses and they present components of them on their surface to activate the rest of the immune system. That's the beauty of the immune system, is it can be trained and harnessed and spread throughout the body. It increases interferon alpha and beta, which is important in immune response. Natural killer cells, increases natural killer cell number and activity. Now, what are natural killer cells? Give you a hint. Exactly what their name implies. They naturally kill. Now, they are involved in cancer. They're involved in infectious disease, but they need to be targeted nonetheless. Protection. It protects lymphocytes and neutrophils against oxidative damage. Again, when we have all this inflammation, oxidative burst associated with the inflammatory response related to this infection, here we're talking about viruses, what you get is you get a lot of spread and collateral damage to surrounding immune cells, lymphocytes, neutrophils, from this oxidation. And so in the infectious, vitamin C can have one effect, that's cytotoxic, inhibiting replication, etc. But then it protects and preserves the immune system that is in part and parcel to killing the virus. It increases lymphocyte production. It increases neutrophil activation and function. And it increases dendritic cell activation and antigen presentation, another type of antigen presenting cell. So going back to Jungeblut CW in 1935, when he first talked about the poliomyelitis and vitamin C, that's really the first concept. Vitamin C can truthfully be designated as the antitoxic and antiviral vitamin. That was a quote from his article from 90 years ago. Let me repeat it. Vitamin C can truthfully be designated as the antitoxic and antiviral vitamin. Wow. Wow. Now, in 1951, I already mentioned Klenner. He had an article that he published, Massive Doses of Vitamin C and the Virus Diseases. He had this quote from it, and he was referencing here measles. Hippocrates declared the highest duty of medicine to be to get the patient well. Used to be. He further declared that of several remedies, physicians should choose the least sensational. And here's his attribution. Vitamin C would seem to meet both requirements. Looking at herpes zosters. This is from a 2020 article, Ali and Nader, the effect of ascorbic acid in treatment of patients with herpes zoster, shingles. Varicella zoster is chickenpox. This is the remanifestation, reactivation. That's herpes zoster. In this, they use 1,500 milligrams oral daily vitamin C for 2 weeks. And they estimated the vitamin C levels here. They did not actually measure them. But here was a quote from their publication, their article. Vitamin C has an important role to cure. That's a strong word. Cure the patients with herpes zosters rapidly, with less pain than those patients with low vitamin C concentration. So if you've ever had shingles, you know how painful it can be. It could be scarring. I mean, I had it on my forehead. That's why I got a scar on my forehead. It's very painful. But the earlier you can treat it, the more rapidly you can cure it. Not my words, 2020 articles words. Now, I grew up during the 80s. That was the Madonna, the Def Leppard years, Michael Jackson, Thriller, But I wouldn't do him justice. Trust me. I'm a white boy, and this white boy can't dance. My wife can, but I sure can't. But looking at HIV, during the 80s, the mid-80s, HIV was, it struck such fear in people, such fear. And in 1990, suppression of human immunodeficiency virus replication by ascorbate, that's ascorbic acid, in chronically and acutely infected cells. Quote from that, they said, consistent with the mechanism of action in which ascorbate exerts a post-translational inhibitory effect on HIV. Again, translation is RNA into protein, and here it says vitamin C is affecting post-translationally. So you might say it's post-transcriptomics. It's in that proteomics area. But that's 1990, so right in the middle of that HIV, hysteria and tragedy that was really affecting really the world. What about other viruses? We talked about polio. We talked about HIV. Now here we're starting to get into more humans and less cells and those kind. But Epstein-Barr virus. Now this has a connection to cancer because Epstein-Barr virus can trigger some types of lymphoma, particularly what's called Burkitt lymphoma. Burkitt's lymphoma, not singular, it's plural. Now, this was an in vitro study, but effects of high-dose vitamin C on Epstein-Barr viral infection, published in 2014, quote, millimolar levels, millimolar, again, not micromolar. Micromolar is the only level you can get in the plasma from oral. IV is going to give you the millimolar in the plasma. Millimolar levels of ascorbic acid hinder viral infection and replication in vitro. As I mentioned, in vitro study, that's preclinical studies, cells in a petri dish. It's not in vivo or animal models or even clinical, that is human trials. 2018, influenza, flu. Here it is, November 2024, and it is flu season, or we're headed into it. 2018 study entitled High Dose IV Vitamin C and Influenza. Now, it's a case report, but understand there are degrees and different levels of evidence. We cannot, completely discount maybe a level of evidence that is below that of a randomized double-blinded placebo-controlled trial. It is quote unquote the gold standard, but I always wonder what randomized double-blinded placebo-controlled trial actually was actually studied and used to declare that a randomized double-blinded placebo-controlled trial is actually the best form of the study. There hasn't been one. So when we look at this data, we have to understand that it's something that's just evolved. When we look at observation studies, when we look at meta-analysis studies, these also play a high degree in the quality of evidence that we evaluate. But so much of what happens and how science begins, it begins with observation. And observation begins with case reports. That's where that process begins. But in 2018, entitled High Dose IV Vitamin C and Influenza, the case report. And they said all of this evidence confirms the effectiveness against viral infections. So they're just saying that vitamin C in these case reports of influenza showed its effectiveness against the infection. So we went through EBV, we were from HIV to EBV to influenza. And then again, I can't move through the viruses as the component of the infectious disease without touching on coronavirus. Now, coronavirus is the larger family. SARS-CoV-2 is within that. But coronavirus before SARS-CoV-2, so before 2019, we would have just said, oh, that's the common cold. And that's really, the common cold is within that larger coronavirus family. So looking at some studies, 2006, immune-enhancing role of vitamin C and zinc and effect on clinical conditions. And in this, they looked at 6 randomized controlled studies, showed that vitamin C supplementation, this is oral, decreased the incidence of common cold in 642 marathon runners, soldiers, and skiers by 50%. Wow. So vitamin C supplementation with zinc reduced the incidence of the common cold in people at high risk. Marathon runners. That's a high oxidative process, training, competing. And what happens is you break the body down and you get vulnerable to infection, cold. Here, vitamin C and zinc helps to reduce it by 50%, the incidence. 2013, vitamin C for preventing and treating the common cold, again, coronavirus. Quote, meta-analysis found that vitamin C supplement of more than 0.2 grams per day in adults and 1 to 2 grams per day in children reduced duration and severity of common cold. Not my words. The published, again, check out the show notes. 2018, extra doses of vitamin C based on daily supplementation shortens the common cold, a meta-analysis of 9 randomized controlled trials. And here they showed a meta-analysis of 9 randomized controlled trials showed that the extra therapeutic dose of vitamin C at the onset of symptoms, timing is so key here. You wait too late and the infection really has a chance to ramp up, you're going to get less dramatic of an impact. Still going to have an impact, but less dramatic. So at the onset of symptoms, in addition to routine vitamin C supplement, relieved common cold symptoms and decreased the duration of illness. So here we're talking about decreasing the incidence. We're talking about shorter duration. We're talking about relieving symptoms earlier. That's oral vitamin C. That's not even IV vitamin C. And remember, there's a 2-phase compartmentalization of how vitamin C is absorbed, where in plasma levels less than 70 micromolar, you're going to absorb the vitamin C via the gastrointestinal tract aggressively, but the kidneys are going to reabsorb it so as to help support the plasma ascorbic acid levels. But when those plasma ascorbic acid levels exceed the 70 micromolar, then the kidneys are going to pee it out. And when you take a lot of vitamin C by mouth, you poop it out too, cathartic effect. So here was a 2021 article. So right in the middle of the pandemic, talking about SARS-CoV-2. It was entitled The Effects of Vitamin C on the Multiple Pathophysiological Stages of COVID-19. So, quote, vitamin C has an immune supportive, antiviral, and anti-inflammatory, antioxidative, antithrombotic, and many other beneficial properties. Because it has all these capacities, it can be concluded that vitamin C, especially high-dose IV vitamin C, can be seen as an important component in the treatment of SARS-CoV-2. What is also important to highlight is that in practically all of the pathophysiologic stages of SARS-CoV-2, vitamin C can have potential role in diminishing its detrimental effects. This is due to the pleiotropic physiologic effects that ascorbate exhibits, such as inhibiting the cytokine storm, reducing oxidative stress, decreasing inflammation, and preventing thrombotic complication, among others. Moreover, vitamin C has a capacity to reduce mortality in COVID-19 patients while providing better clinical outcomes that do not include harsh side effects to the body. By supporting vitamin C to COVID-19 patients, research states that it can reduce the high doses of medications like corticosteroids. Vitamin C is a safe and low-cost option that should be contemplated as part of the treatment of COVID-19 patients. Now, this was early. They were trying to say, look, we've got all this viral evidence, and there's reasons to suggest that it should be effective against SARS-CoV-2 because that's a component within the coronavirus family. It's effective against coronaviruses. It's been shown to be helpful against HIV. It's been shown to be helpful against EBV. Why would it not be helpful here if timing's appropriate? And by the way, it's safe. The toxicity profile is completely safe, and it's low cost. Low cost. Maybe that was part of the problem. So just really interesting timeline here. I gave this I gave this as a presentation in Florida back in 2022, and I created a timeline on a couple of slides here, going through what we knew about vitamin C specifically as it relates to COVID-19. So a 2020 article was actually showing that high-dose IV vitamin C is recommended to prevent cytokine storm. Now, that's important because the cytokine storm is what really the viral infection triggered off, and this created all the collateral damage in the lungs. Another 2020 article, and this Paul Anderson was a part of this, successfully treated 50 patients with moderate to severe COVID-19 with high dose of IV vitamin C. So again, they weren't creating a study or actually an article here with selection bias by choosing people with low severity of COVID-19. They picked moderate to severe, and they used 10 grams daily for moderate cases, 20 grams daily for severe cases for 7 to 10 days. And they improved the clinical outcomes compared with the untreated groups. This treatment regimen shortened the duration of hospital stay by 3 to 5 days, and there were no mortalities reported in the treatment group. Safe, readily available, lower cost. Why? And again, that other article suggested we could lower the corticosteroids. We could lower the dosage of other medications. Another 2020 article by Beretti and Benick. It's believed that IV vitamin C has been particularly effective by inhibiting the production of cytokine storm due to COVID-19. Again, when you look at chemotherapy and cancer, chemotherapy it can kill cancer cells, of course, and shrink tumors, but it can trigger a cytokine storm, and that could be some of the mechanisms by which cancer can then metastasize. But what happens in cytokine storm is this infectious here in the SARS-CoV-2 or COVID-19 pandemic is it triggered an inflammatory response that was so egregious, so out of control that the level of immune signaling, that's cytokines, became out of control and became a storm that ravaged the body. And it particularly ravaged the immune system. It ravaged the endothelium and led to clots. And it just created, it turned the body into a battlefield. Article coming out in 2020, also hospital-based IV vitamin C treatment for coronavirus and related illnesses. And so what they saw here is it increased the oxygenation and it reduced the 28-day mortality of these patients significantly, not marginally, but significantly. Paul Merrick co-authored an article where they reduced the incidence and duration of respiratory infection with IV vitamin C at 6 to 24 grams per day, and this reduced mortality, intensive care unit stay, and hospital stays. And they also were able to reduce the time on mechanical ventilation, which the longer they were on mechanical ventilation, the higher the mortality rate. That's 2020. 2020. High dose vitamin C infusion may significantly affect therapeutic agent, may be a significantly effective therapeutic agent in COVID-19 treatment. Early 2021. I mean, it really causes you to take pause and go, what? Why? How many people's lives were lost unnecessarily? And how many lives could have been saved? I actually had 2 patients I can think of, that we tried to not send patients to the hospital, treating cancer patients. But guess what? Sometimes when you treat cancer patients, they have to go to the hospital. And one patient went to the hospital and never left, and his wife never saw him again. As he was dying in the hospital bed in the hospital, they wouldn't let his wife come see him. Second patient refused to go to the hospital, and finally told him he could go to the hospital and that I would do everything I could to get his wife there to see him if he was not doing well. And everything I could do did nothing, and he passed away in the hospital, and they would not let his wife come and see him. These are stories, these are experiences that imprint on you. They affect us. And I don't know that we in medicine will ever be the same because of this pandemic. It'll take a while to heal. And when you look at the trust that the general public has in medicine, it's dropped drastically. And it's no surprise. No surprise at all. So we've talked a lot about viruses. What about bacteria? First mention of vitamin C as it relates to a bacterial infection is 1946. So not as early as viruses, but 1946 versus 1935. 2008, penicillin and vitamin C in the treatment of hypopion ulcers. What about sepsis? Well, IV megadose sodium ascorbate reversed the pathophysiologic and behavior responses to gram-negative sepsis without adverse side effects. They used IV sodium ascorbate at 0.5 grams per kilogram that was initially given over 30 minutes, and then they followed this with 0.5 grams per kilogram per hour for about 6.5 hours. The average was 5. And they had a massive response to gram-negative sepsis without adverse side effects. 2019, immunomodulatory and antimicrobial effects of vitamin C. It's important to understand that with vitamin C, if we talk about sepsis, dosing, timing, and frequency is important. Even with the pandemic or any type of sepsis or infectious degree that is leading to multi-organ system failure, it doesn't matter if it's an antibiotic, an antiviral that is FDA approved. If you miss the window, you miss the opportunity to initiate treatment, you're going to miss the potential impact to change the life of that individual and save them. So you can set up a study that is delayed in the initiation of treatment with the intent to create a clouded outcome. So see, when you look at science, science is about asking questions and just following the answers. It's not about creating the answer and then creating the study and the questions that bring you the answer that you want. But that's what we've seen with quite a number of natural therapies as it relates to sepsis, infectious disease, is they create the preconceived biased answer, and then they construct the study, they delay the treatment to the outcome they want. So 1946, 2008, 2019. So let's get into some other specific bacteria. Diphtheria, 1935. Jungeblut, I was wrong when I mentioned the 1946. Here I'm talking about 1935. He looked at diphtheria with crystalline vitamin C. Detoxification of diphtheria toxin by ascorbic acid therefore represents but one action of physiologic agencies in the nonspecific inactivation of toxins and viruses. Jungeblut was busy. He was busy. Viruses and infectious disease with vitamin C. 1935, tetanus. Vitamin C, when added to tetanus toxin in vitro, brings about inactivation of the toxin. Toxin. I've heard that word before. Oh, spike proteins. I'm being facetious, clearly. Spike protein. A lot of people, I think there was a lot lost on most, and doctors did not do a good job of explaining this, surprise, that when you talk about the spike proteins, and particularly when you're talking about the vaccinations and the boosters, that spike protein, that messenger RNA, it's producing spike proteins, a toxin. So that's why some people had significant issues related to it. You were actually encoding a messenger RNA code that would produce toxins for extended periods of time. And we really don't even know how long. And we're now all affected. But we're introducing the ability to produce a toxin maybe in perpetuity in the body. I don't know. And we shouldn't be surprised that we now have all these negative effects. 1937, ascorbic acid likewise inactivates a number of other bacterial poisons, tetanus, staphylococcus, dysentery, and anaerobic toxins. Wow. So here we're not just talking about bacteria, we're talking about toxins produced by bacteria. So let's move a little bit more modern and look at tuberculosis, Mycobacterium tuberculosis. 2013, looking at drug-resistant, drug-susceptible, multi-drug-resistant Mycobacterium tuberculosis. Vitamin C has been shown to inhibit the biofilm growth as well as disrupt the foreign biofilm in mycobacteria. Additionally, vitamin C role in cell-mediated and humoral immunity has been elucidated, meaning they've determined it. Vitamin C is toxic at high concentrations to the bacteria. Here it's Mycobacterium tuberculosis. So vitamin C here is targeting the bacteria, but it's also targeting the biofilm. And this is this congregation of this aggregation of material around bacteria, and viruses can do the same thing, and it protects and congregates these bacteria to preserve them in an inhospitable environment. 2018, vitamin C potentiates the killing of Mycobacterium tuberculosis by the first-line tuberculosis drugs ionizide and rifampin in mice. So it potentiates the conventional therapy. See, that's the great thing about natural therapies is they really augment natural therapies. So with the natural therapies, vitamin C here, they augment conventional therapies. Getting tongue-tied here. But vitamin C alone can be effective, but vitamin C also can be an adjunct, a complementary therapy with conventional therapy. So you don't have to abandon conventional medicine if you're opposed to it. A lot of docs out there go, I don't want to just do vitamin C. Guess what? You don't have to. You can use it in conjunction with. But understand that in many cases, it standalone can work for the solution you're after. 2018, vitamin C, a natural inhibitor of cell wall functions and stress response in mycobacterium. So what we're seeing here is, the impact of vitamin C in a very deadly, very, very deadly bacteria, Mycobacterium tuberculosis, where it kills, let me get back to this slide, where at the time of the COVID pandemic, it was the number 2 infectious disease killer behind COVID. In 2020, 1.5 million deaths were attributed to Mycobacterium tuberculosis. And it was a leader in mortality globally. It was number 13. It wasn't number 1, but it was number 13. And here, vitamin C could be an effective treatment against the bacteria, against the cell wall protective functions and the biofilms that help to preserve and protect these infectious bacteria. So viruses, many types, bacteria. many types, history, long-standing, evidence broad, in vitro, animal, even human studies as we start to get into the bacteria, and even some of the viruses, particularly related to the SARS-CoV-2, HIV, etc. What about parasites? Because parasites are a component of infectious disease. Well, globally, 3.5 billion people are affected, according to the World Health Organization. Approximately 450 million are symptomatic, and roughly there's 200,000 deaths attributed to parasites globally. And what we know about 3 multicellular parasites, Schistosoma hematomium, Opisthorchis ververini, Clonorchis sinensis, is that these are recognized as group 1 carcinogens, and they contribute to 0.4% of human cancers. Now, this increased risk of cancer is associated with increasing numbers of other parasites. So the more parasites that are out there beyond just these 3, obviously these numbers are almost guaranteed underrepresented. So we're probably looking at a contribution of parasites as a carcinogenic process here. They're infections, but into the carcinogenic process that's well beyond what we currently understand. And viruses, we know, approximately 15% of all cancers are caused by viruses. There are some studies that estimate that infectious diseases as a whole contribute to 25% of all cancers. And when we look at viruses, there are at least 8 oncogenic viruses, cancer-causing viruses. And when you look at the literature and how it defines those viruses as a cancer-causing virus, SARS-CoV-2 virus, the COVID-19 virus, checks every box. And again, that's not a political statement. That's just looking at the science and being objective about it. So antiparasitic, vitamin C reduced Trypanosoma cruzi and Plasmodium yellow. That's malaria parasite accounts in vivo mouse models. So mouse model, not human. It's preclinical, but it's in mice model. Vitamin C possesses potent antimicrobial properties, reducing pathogenicity of bacteria, viruses, parasites, and fungi. Wow. So it's not just viruses, bacteria, parasites, oh my, but fungi. 1947, first report published looking at the treatment of iron and vitamin C in association with malaria. 1957, the intensity of infestation and rate of purification looking at the guinea pigs, the Shigella dysentery, and treating or seeing a reduction in that with ascorbic acid feeding. In the 1960s, ascorbic acid content of blood and urine, looking at the anemic versus non-anemic carriers of tapeworms. So this impact of vitamin C extends well into the antiparasitic. So let's look at those 3 identified viruses that are class 1 carcinogens. You don't think about parasites as carcinogens, do you? But class 1 carcinogens. Schistosomes. 2019. Supplementation reduces infestation with schistosome species by over 33 times compared to placebo. In individuals infested with Schistosome mansoni, supplementation is 30 times more effective than placebo. And for individuals with Schistosoma hematomium, supplementation is 62 times more effective than placebo. So no placebo effect, but significantly improved treatment compared to placebo. Again, that was 2019. That was meta-analysis. Opisthorchis ververini. They fed a diet supplemented with 2,000 milligrams orally, not much, of these. They used silver bards. They were using silver bards for the treatment here as the treatment vivo. And what they found is that they were able to resist the Opisthorchis ververini infection with 14 days of 2,000 milligrams vitamin C. 2019. Clonorchis sinensis, 1985. Infection with trematode affects the ascorbic acid balance of mollusks with very high infections, causing increased concentrations within the hemolymph, along with a decrease in the reserves within the body tissue. So again, showing that infection was actually depleting the vitamin C in the mollusks here. And obviously that's going to negatively impact the hematogenous and the lymphatics, and thus really affect the immune system, and this is how an infection can spread. And this was a study that was conducted in freshwater gastropods. So again, when when we look at parasites and vitamin C here, we're not finding any human studies, right? And so we have to recognize the limitations of this evidence. And when we look at science as it relates to any treatment, there's no, consensus. Everybody talks about consensus. Like, science is not a consensus. Science is actually an open debate and discourse of ideas. That's what science is. It's about a curiosity in mind. It's about asking questions, getting answers, and then asking more questions and getting more answers, and then putting them out into the public arena for discussion and debate. Consensus is never the goal of science. It's about curiosity. That's what science is about. And we have to recognize where we have a lacking of human science as it relates to vitamin C, and we do. But we have a predominance of evidence that does show that vitamin C can be effective in infectious diseases. Well, let's connect this to cancer. Cholangiocarcinoma, a very deadly form of cancer. Anti-proliferative and apoptotic effects of high-dose vitamin C in cholangiocarcinoma cell line. Preclinical, yes, that's the limitations here. Their conclusion here was that our results showed that the mechanism of anti-proliferation effects of ascorbic acid in cholangiocarcinoma may be attributable to the modulatory expression of BCL2 and BAX proteins and dissipation of mitochondrial electrochemical potential gradient, which is an early stage of cancer death. Whew, a lot of words there. BCL2 and BAX are proteins within the greater family of BCL, and these balance of the BCL2 BAX actually regulate apoptosis, that's programmed cell death. The BAX increase apoptosis, and the BCL2 reduce apoptosis, or they're anti-apoptotic. So here, when we talk about cholangiocarcinoma, why is this relevant to the discussion of infectious disease? Parasites. Look, liver flukes. Parasites. Don't see a lot of that here in the U.S., but parasites can directly contribute to cancer. As I mentioned, those three, 0.4% of cancers, but liver flukes and cholangiocarcinoma, it's very much a direct connection. Malaria. In 2015, there were two prominent drugs that teams won Nobel Prize in Medicine Physiology on, and they were both about and regarding malaria. Artesunate one, and the second one was ivermectin. Malaria is one of the most significant public health problems in developing countries today. 1992, the effects of ascorbic acid induced free radicals on Plasmodium falciparum, malaria. 2021, differential effects of antioxidants, glutathione and vitamin C on the hepatic injuries induced by Plasmodium burgeri. Now, this is interesting. I want to read you a component here of this study, because a lot of people would do vitamin C and they just blindly do vitamin C and glutathione together and think that there's no issues related to that. But let me read this piece from it. Mice were inoculated with parasitized erythrocytes and treated with glutathione and vitamin C separately, both at 8 milligrams per kilogram during 7 consecutive days. Our data showed that during the Plasmodium infection, again malaria, treatment with glutathione promoted significant decrease in the survival of infected mice, accelerating the disease severity. However, treatment with vitamin C promoted an improvement in clinical outcomes and prolonged the survival curve of the infected animals. We also showed that glutathione promoted increase in parasitemia rate of Plasmodium-infected animals, although treatment with vitamin C induced significant decreases in parasitemia rates. Furthermore, histological analysis and enzyme biochemical measurement showed that treatment with glutathione exacerbates liver damage, while treatment with vitamin C mitigates the hepatic injury induced by the infections. So many people will go into doctors and get vitamin C and glutathione reflexively. And then when we get into the arena where we dive deep into the understanding of cancer, particularly about how vitamin C induces a redox crisis, an energy crisis, and a detoxification crisis. Adding glutathione there is not what you want. But here, they're actually showing in infection, again, mouse model, not humans, but in mouse model, that the glutathione countered the anti-malarial effect of vitamin C, but also that the glutathione increased the parasitemia, the level of parasites in the blood. And that the glutathione created more damage to the liver, whereas vitamin C countered it. 2021, vitamin C inhibits blood stage Plasmodium parasites via oxidative stress. So, that's why when I look at cancer, one of my favorite treatments from an integrative perspective is artesunate plus vitamin C. I call it A before C therapy. And this strategy here in malaria it would be highly effective. Artesunate, guess what, is approved for malaria. It's the gold standard treatment for malaria is artesunate. And you couple it with vitamin C. Here they're talking about vitamin C being effective against malaria. Couple them together, you got a treatment. So think of the number of people in the world with malaria that could be treated with artesunate and vitamin C. We do it for cancer. Why can't we do it for the infectious disease malaria? Lyme, Borrelia burgdorferi. What a name. Effective invasion of Borrelia burgdorferi in normal and neoplastic mammary epithelial cells. Now, this is interesting. This is a cell culture. They looked at breast cancer cell culture study. They saw a 4-fold significant increase in invasion of the breast cancer cells after infection with the Borrelia burgdorferi as compared to the uninfected cells. Let me break that down. Infectious disease here is infecting breast cancer, and that's accelerating its invasiveness. Borrelia burgdorferi is able to invade breast epithelial cells, and its infection can increase the migration invasion of cancer cells as well as increase the expression of matrix metalloproteinases. There's been a finding that shows that doxycycline, the frontline antibiotic treatment for Lyme disease, if you have Lyme disease, you know about that, but in combination with vitamin C and vitamin D can eradicate cancer stem cells. So here we can use these therapies. So if somebody has breast cancer or they have a history of breast cancer, we're worried about recurrence. We're worried about, if active cancer is ongoing and we're worried about progression and Lyme is present or there's a history of Lyme, guess what? That Lyme, that Borrelia burgdorferi could actually invade the breast cancer cells, at least according to the cell culture. This has not been translated to in vivo, that in animal models or humans, but here it could actually accelerate the progression, the invasion of the progression, the spread of the cancer. But by combining doxycycline with vitamin C and vitamin D, we actually could, if somebody's in remission, actually target cancer stem cells that way. See, the greatest battle with cancer doesn't begin with treatment. It actually begins when people achieve remission, because that's where nothing's done currently. So what we can do is actually target, if Lyme is present, we can actually target the ability of cancer to invade and spread. But also, if Lyme history is there and we're worried about reactivation or coexisting infections, though this doesn't specifically look at those, we could actually help to slow the disease or maybe reverse it with things like doxycycline, vitamin D, and vitamin C. And by the way, doxycycline is a reprogrammed medication in cancer. It's a great glycolytic inhibitor. I saw actually a study paper from 2016, not a study paper, but a poster. It was it was that one looking at the Borrelia burgdorferi and breast cancer. They showed that 90% spirochete killing occurred because of the combination of that vitamin D3, vitamin C, and doxycycline. Combination of doxycycline with these compounds allowed for a 50% reduction of antibiotic concentration, killing 90% of the spirochetes. That's what Borrelia burgdorferi is. And it reduced the biofilm, it eradicated it in 50-60%. Dramatic. So we don't need to look at cancer and just say infectious disease is not a contributing to its causation. We know it does. But likewise, if cancer is present, we can't ignore the evidence that infectious disease can contribute to its ongoing progression and even spread. So in the prevention strategy, vitamin C can be effective against infectious diseases, virus, bacteria, and parasites, all of which have been shown to cause some type of cancer. Again, as total 25%, according to the World Health Organization. But vitamin C can be used against those infectious diseases, and that's going to have a positive impact on preventing the incidence of future cancers that result from those infectious diseases. But likewise, if cancer exists and infectious disease is chronic or coexisting or accused in an acute setting, we can actually use vitamin C there as well, as some of these preclinical studies show, to prevent the progression moving forward. So I'll close with this. There's this concept within virology called immunotolerance, where the ability to evade the immune response is perhaps the most important aspect of viral persistence and proliferation. It's a quote by Doris Lowe. She's a researcher and author. Interesting. The ability of a virus to continue to exist and to grow is by creating an immune environment that allows it to be tolerated. Immunotolerant. Tolerance of the immune system to the presence of the virus. Take out virus and insert cancer. The ability to evade immune response is perhaps the most important aspect of cancer persistence and proliferation. See, when we talk about infectious disease and we talk about cancer, we're not talking about them indistinguishably. They are coexistent. They do affect each other. And when we look at the concept of infectious disease, particularly viruses, but also bacteria and parasites, we have to be considering the concept of cancer. Because cancer right now is the pandemic that nobody talks about. And vitamin C may be the best answer to treat infectious disease, but also to prevent cancer and to treat cancer, and maybe even treat infectious disease with those that actually have active cancer or in remission. So I hope this information has been helpful to really kind of open your mind as to the evidence, the science behind vitamin C. Again, please check out the show notes where the evidence will be documented. There'll be plenty of studies there. I encourage you to read the studies for yourself. Don't take my opinion for it. We have to recognize the positive, negatives, and the limitations of all the research, and I've tried to highlight that. I try to continually highlight that throughout the social media posts, the blog posts, and the podcasts that we do. You trolls that are out there, read the research before you say something. And I just encourage you to share this with those that would benefit from this information, whether that's those with infectious disease, whether it's those with cancer. Also, share, like, and subscribe this information. Please download the podcast, give us a 5-star review, and thank you for joining us on this Prescribed by Dr. Nathan Goodyear podcast, and we will talk to you next time. Thanks for joining us on this episode of the Prescribed Podcast. All references supporting this episode can be found on the prescribed.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.